The world is witnessing a resurgence of a familiar foe, Human Metapneumovirus, or HMPV. This virus, which has been known to scientists for decades, is now making a significant impact once again. This respiratory virus, often mistaken for the common cold or flu, is causing concern as cases surge in China and India. The symptoms, which include coughing, fever, and shortness of breath, can be particularly severe in young children, the elderly, and those with pre-existing health conditions. Crowded streets, bustling markets, and overwhelmed hospitals paint a picture of a healthcare system grappling with a new wave of infections. The high population density in urban areas exacerbates the spread, making it difficult to contain the virus. This isn't the first time HMPV has made headlines. Historically, HMPV has caused outbreaks that have strained healthcare systems, but the current surge is unprecedented in its scale and speed. The virus has been circulating for decades, often causing mild to moderate respiratory illnesses. However, in some cases, it can lead to severe complications, such as pneumonia, bronchiolitis, and even acute respiratory distress syndrome. However, the recent surge in cases, particularly among vulnerable populations, underscores the importance of understanding this often overlooked respiratory threat. The elderly and immunocompromised individuals are at a higher risk, necessitating increased vigilance and care. As we navigate this new surge, it's crucial to equip ourselves with knowledge about HMPV, its modes of transmission, and effective preventive measures. Simple actions like wearing masks, practicing good hand hygiene, and avoiding crowded places can significantly reduce the risk of infection. Staying informed and following public health guidance are paramount in mitigating the impact of this evolving health challenge. Public health campaigns and community outreach programs play a vital role in educating the public about the virus and how to protect themselves. The global health community is closely monitoring the situation, emphasizing the need for robust healthcare infrastructure and international collaboration to combat the spread of HMPV. Researchers and healthcare professionals are working tirelessly to develop better diagnostic tools, treatments, and potentially a vaccine to curb the impact of this virus. The development of a vaccine could be a game changer in the fight against HMPV. Until then, preventive measures and timely medical intervention remain our best defense against this persistent and evolving threat. Community efforts and individual responsibility are crucial in managing the spread of HMPV. By working together and staying informed, we can protect ourselves and our loved ones from this resurgent virus. Human Metapneumovirus, or HMPV, is a respiratory virus that commonly affects young children, older adults, and individuals with weakened immune systems. It was first discovered in 2001, but researchers believe it has been circulating among humans for much longer. HMPV typically causes mild, cold-like symptoms such as runny nose, cough, sore throat, and fever. However, it can lead to more serious respiratory infections like bronchiolitis and pneumonia, especially in vulnerable individuals. The virus spreads through respiratory droplets produced when an infected person coughs or sneezes. These droplets can infect others if they land in their nose or mouth or are inhaled into the lungs. HMPV can also spread through direct contact with contaminated surfaces. Understanding the symptoms, transmission routes, and risk factors associated with HMPV is crucial for effective prevention and control. Simple measures such as frequent hand washing, covering coughs and sneezes, and avoiding close contact with sick individuals can significantly reduce the risk of infection. China, with its dense population and interconnected cities, has become a focal point for the recent surge in HMPV cases. Hospitals are reporting a significant increase in patients, particularly young children and older adults presenting with respiratory illness. The World Health Organization, WHO, has expressed concern over the situation in China, urging heightened surveillance and public health measures to control the spread of HMPV. Chinese health authorities are working diligently to track the virus's spread, implement preventive measures, and provide timely medical care to those affected. The surge in HMPV cases coincides with China's flu season, adding another layer of complexity to the situation. The co-circulation of multiple respiratory viruses underscores the importance of vaccination, especially for vulnerable populations, as a crucial step in reducing the overall burden of respiratory illnesses. China's experience with the HMPV outbreak serves as a stark reminder of the interconnectedness of global health and the importance of robust surveillance and response systems to effectively manage emerging infectious diseases. Section 4. HMPV reaches India. First cases and expert opinions. India, home to the world's second-largest population, confirmed its first cases of HMPV in recent weeks, raising concerns among health experts. The virus, which has already caused significant alarm in other parts of the world, is now making its presence felt in this densely populated nation. The initial cases were reported from major cities, highlighting the virus's potential to spread rapidly in densely populated areas. With cities like Mumbai, Delhi, and Bangalore being hubs of activity, the risk of transmission is particularly high. The bustling streets and crowded public spaces provide an ideal environment for the virus to propagate. Indian health experts are urging caution and emphasizing the need for increased awareness about HMPV. They are calling for public health campaigns to educate the population about the symptoms and transmission methods of the virus. Press conferences and media briefings are being held regularly to keep the public informed and to dispel any misinformation. They stress the importance of early detection, isolation of infected individuals, and adherence to preventive measures to curb the virus's spread. Testing facilities are being ramped up, and healthcare workers are being trained to handle the influx of patients. Preventive measures such as wearing masks, frequent hand washing, and maintaining social distance are being strongly recommended. The emergence of HMPV in India underscores the global reach of infectious diseases and the need for international collaboration in sharing information, resources, and expertise. Experts from around the world are coming together in virtual meetings to discuss strategies and share their experiences in dealing with the virus. This global cooperation is crucial in developing a unified response to the outbreak. Health authorities in India are working closely with global health organizations to monitor the situation, strengthen surveillance systems, and implement effective control measures. The World Health Organization, WHO, is providing guidance and support to ensure that the response is swift and effective. Data is being meticulously collected and analyzed to track the spread of the virus and to identify any emerging hotspots. The situation in India is a reminder that infectious diseases know no borders, and that a coordinated global response is essential to protect public health and mitigate the impact of emerging health threats. The international community must remain vigilant and proactive in its efforts to combat HMPV and other infectious diseases. By working together, sharing knowledge, and supporting each other, we can hope to overcome this challenge and safeguard the health of populations worldwide. Section 5. HMPV versus COVID-19. A tale of two viruses. While both HMPV and COVID-19 are respiratory viruses that can cause a range of symptoms, there are key differences between the two. These differences are not just limited to the severity of the illnesses they cause, but also extend to their transmission dynamics, the availability of vaccines, and the overall impact on public health. Understanding these distinctions is crucial for appropriate prevention and treatment strategies. By recognizing how each virus operates, healthcare professionals can better tailor their approaches to managing outbreaks and treating patients. HMPV typically causes milder illness compared to COVID-19, especially in healthy adults. Symptoms of HMPV can include cough, fever, and nasal congestion, which are often manageable at home without the need for extensive medical intervention. While both viruses can lead to severe respiratory complications, this is more common with COVID-19, particularly in individuals with underlying health conditions. COVID-19 has been known to cause severe pneumonia, acute respiratory distress syndrome, ARDS, and multi-organ failure, necessitating intensive care and prolonged hospital stays. While both viruses spread through respiratory droplets, COVID-19 is known for its high transmissibility, partly due to its ability to spread through airborne particles. This means that COVID-19 can spread more easily in crowded and enclosed spaces, making it more challenging to control. HMPV, on the other hand, is primarily spread through larger droplets that travel shorter distances. This makes it somewhat easier to contain through standard infection control measures such as wearing masks and maintaining physical distance. The availability of vaccines and treatments also sets the two viruses apart. The rapid development and distribution of COVID-19 vaccines have been a game changer in controlling the pandemic, significantly reducing the severity of the disease and the number of hospitalizations. While effective vaccines and antiviral treatments are available for COVID-19, there are currently no specific vaccines or treatments for HMPV. This lack of targeted interventions makes managing HMPV outbreaks more challenging, relying heavily on supportive care and preventive measures. Despite these differences, The fundamental principles of prevention remain similar. Frequent hand washing, respiratory etiquette, and avoiding close contact with sick individuals are crucial in reducing the spread of both HMPV and COVID-19. Additionally, public health campaigns and community awareness play vital roles in educating people about these preventive measures, ensuring that everyone can contribute to controlling the spread of these viruses. In conclusion, while HMPV and COVID-19 share some similarities as respiratory viruses, their differences highlight the importance of tailored public health strategies. By understanding and addressing these differences, we can better protect our communities and improve health outcomes for all.